medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, everyone, and welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. You're able to watch us on AMP2 TV and listen to us on 96.9 and 93.5 FM. I am your host, Raymond Phillips, and today we have a very special guest with us today, Miss Judith Scott. Welcome to the show.
Thank you so much for having me.
It's a pleasure, and it's our honor to have you on the show today. Ms. Judith Scott is the owner of Healthcare Navigation Systems Clinic. They are located at 10287 Okeechobee Boulevard, Unit A6, West Palm Beach, Florida, 33411. They are located on the corner of Cobblestone Village, Shopping Plaza, 441 and Okeechobee. And if you need to reach their office, their number is 561-223-6460. So, Miss Scott, again, it's such an honor to have you here today. How are you doing?
I'm doing great. It's great to be here.
Awesome. Well, let's just jump right into the interview.
Okay.
So tell us and the listeners a little bit about your background in the medical field.
Okay, well, first of all, my background was in business. I spent quite a bit, maybe over 20 years in business.
Wow.
And I got into healthcare because of my mother. She says that she thought that it would be a good field for me. Instead of doing an MBA, I decided to go to do nursing. And I did, but I went back into business. And later on, I decided to marry them both. So I married my background in healthcare and my background in business. And I worked in pretty much administrative roles in most of the care settings. So I've worked in a rehab facility, I've worked in home care, I've worked in the hospital setting, I've worked as a liaison with the hospitals. And so I got a chance to see, to have a view of the delivery of care in the entire continuum.
In the entire process.
Yes.
Wow.
And actually my last assignment was with NYU Hospital.
I was actually just about to ask you about that. I saw that you worked in the Medicare bundle program at NYU.
Absolutely. They were one of the first hospitals to launch, to pilot that program. And I was a part of a very small team. And I learned a lot from that, because I understood the importance of good patient outcomes and provider outcomes. And I understood that care coordination, managing the transition process for the patient was very important. And I saw that our healthcare system could benefit from someone who had experience with that. So when I migrated or came to Florida, I got a chance to understand the landscape as part of different organizations, but also worked in settings where I saw where there were opportunities to reduce the gaps in care.
Nice, very nice. Can you tell our listeners a little bit more about what care coordination really is?
Okay, well, it's actually going beyond the care settings or allowing interfacing with patients and families. Where you have a very holistic approach. So, with our care coordination, we would make outreach calls that were initiated by us. And so we were calling the patients basically to find out how we could help to mitigate any challenges before they actually happened and resulted in patients being readmitted or, to the hospital. And so, calling a patient, for instance, here in Florida, it was a 95-year-old lady that I had built this relationship with. Wow. And her decision was, I don't know that I can go to the hospital because I have a dog and there'll be no one to take care of my dog. Now, something as simple as that, she lives alone. She lived alone. So being able to have a relationship with your healthcare provider to make that decision. So I think care coordination, there's so many nuances of care coordination. There's a psychosocial part where you are involved with the family. There's the other part where you have to know the patient. You have to be involved with the care of the patient beyond the walls of the practice or the hospital, because that's where I think there are a lot of gaps.
And so that's something that you noticed. So will you be implementing those practices into your new business?
Absolutely.
Amazing.
Absolutely.
So speaking of your new business, tell our listeners a little bit about the practice that you'll be opening.
So one of the when I came to Florida, my goal was to see how I could fit this care coordination in a practice model that worked. And I came across a direct primary care model, which is not unique. It's all over the country. But it allows patients, it's very patient-centric. And it allows patients to spend more time with the doctor. So it gives, first of all, it gives access to people who would not have access to healthcare for a very affordable cost of a subscription fee, and it's monthly fee-based. So patients who are not insured, patients who are underinsured, or patients with very high deductibles, they could benefit from this. Or, small business owners who are not able to cover their employees' health care, or business owners who are not able to cover their health care. So it is not insurance, it's access. So it's for affordable care. And one of the things, some of the value of this model is that you get to spend at least 20 minutes with your doctor. One of the things that I notice is that with the other model where it's the payers, fee for service, is that doctors are seeing a lot of patients, 30, 40 patients. It's not easy to spend that little time with the patient and actually being able to help them manage their care properly. So when I noticed that patients did not know which medications they were on, sometimes they were taking medications for years and maybe they still did not need that medication. For instance, I'd ask them, how long have you been taking this blood pressure medication? And they would say, I've been on it all the time. I said, have you ever logged your blood pressure like for 30 days to see what it was? So how does your doctor know how to treat you if you haven't logged it? Like, this is data that's necessary. So, you're going beyond just, bringing real solutions. Being patient-centric, is actually digging into what the patient needs to help them have better outcomes.
And that is so important, especially nowadays with insurance being so high and all these other factors leading in. More and more people are starting to realize that their health is the number one important thing in their life. And your practice will be able to make it affordable for people to get that health care without having to break their banks in the process. Because, going to the hospital, going to the emergency room, going to urgent care, you're going to be left with a big bill if you don't have insurance or you're underinsured, or even if you still have to pay your deductible.
Absolutely. You're hitting target when you're saying that, because a lot of people, because of it's maybe a barrier being able to afford the health care, they would hold off on going to see a doctor. And they may end up in the emergency room or urgent care, and they're paying a much higher bill. And then, there is a problem now, because maybe you could have used a more preventive measure instead of now you're caring for, an illness that could have been prevented. And a lot of hospitalizations or hospital visits are preventable. So I think having an opportunity to have the access will prevent a lot of those avoidable visits.
No, definitely. So tell our listeners a little bit about your background and how you were able to help manage patient care so that they don't end up in those predicaments.
I think a very important part of this model is the time that will be spent with the patient, one. And two, and when you're spending time and engaging the patient, you're able to gather information that will help them to have better outcomes. Sometimes it's maybe a patient lives alone, or sometimes the patients, they have, there's no medication compliance. Why? Because maybe they can't see the labels because they have something, that's a macro-degenerative problem with their eyes. And so, if the doctor doesn't key into some of these symptoms, maybe the patient came to the physician and is not able to express themselves because for them it's just they're fearful of the doctor, they're fearful to express themselves, and so that limited time in 10 minutes, they're not able to actually tell what their needs are. So we will be able to reach beyond the visit. And not only that, the patient can access the doctor, they can FaceTime the doctor, they can text the doctor. Our goal is to provide access beyond the setting. And so that access will have more conversations that can actually bring more solutions to challenges.
In your opinion, being in this field for 20 plus years of experience, what would you say which age group would benefit most from this access to the doctors without having to go to the emergency room and urgent care and everything?
Everyone would benefit.
Everyone will benefit.
Because when it comes to health, everyone has concerns. Well, the younger people, I would say, they're healthier, but with certain programs, with younger people will not be covered by their parents' insurance, so they may be at a loss to have access. So there will be access for them because the fee is affordable even for a young person age 18 onwards. And so they may need antibiotics or they may need physicals, and so we will be able to provide the solution. Then you have someone who's older, over 65, and we can help with chronic disease management. Helping them to understand more. We're incorporating health coaching, incorporating more teaching, because if we have more time with the patient, you're able to teach more. You're able to identify where the problem is and be able to bring solutions. You're able to help them quarterback and manage their care by collaborating with other specialty groups on their behalf. So I believe that the goal was never, the goal is actually to bring solution, because that's what's needed. In our country, unfortunately, we pay for sick care. The patient has to be very sick to get help. I believe that preventive care is very important. So giving access to everyone, that making it affordable, giving them the time with the doctor, are great value propositions for this type of model.
And I definitely agree with you on that. Being able to form a relationship with your patients on the doctor side allows the patient to be more open with you, allows them to trust you more. And again, on the doctor side, it gives them a more full picture of what's actually happening in the day-to-day basis with the patient's lives.
I'm glad you mentioned that, because one of the focus is also the provider outcomes.
Oh.
Yes, because providers get burnt out because they've got to see so many patients and they're so taxed. And so one of the factors with the direct primary care model is that the provider sees less patients. So the goal is not to maximize the number, which is important, yes, but also when the provider sees less patients and the provider is able to bring better solutions, it's also giving a better provider outcomes. And it's been said that there are less students entering the medical profession.
That's very true.
Yeah, because of the burned out, being burned out. So I think it will serve both the provider and the patient. So that's why we say best outcomes for the patient, best outcomes for the providers.
Because that's also important. You want to keep your doctors healthy and liking the
Absolutely.
environment where they work.
Absolutely.
They're able to do their job with a smile on their face every day.
Absolutely, absolutely.
Definitely. Both
Yep.
of my parents, I mentioned this before, worked in healthcare, and I seen them get burnt out within 1 year of working a certain type of job. And so I can see firsthand about how if it's not managed correctly, if you're seeing too many patients every day, you're not able to give them the care that you want to care because you have nothing left to give from yourself.
Absolutely.
I think that's a fantastic model that you have
Absolutely.
in place in your business. So tell us a little bit about the physicians that will be taking care of your patients at your new clinic.
So the model that we'll have a medical director oversight, and Dr. Sanchez has had over 33 years experience,
Wow.
and he's a DO. And then we'll have a nurse practitioner. I really like that team because a nurse practitioner has that the component of teaching, educating the patients, and also the autonomy of writing scripts and being able to supervise and being able to collaborate with the medical director. So I think it's a phenomenal team.
I think that is a very good system you have in place.
Yes.
Phenomenal team.
Yes.
You hit all the boxes, checked all the boxes right there. And again, for our listeners listening tonight, you're able to find Healthcare Navigation Systems Clinic on 10287 Okeechobee Boulevard, Unit A6, West Palm Beach, Florida, 33411 in Cobblestone Village Shopping Plaza. It's going to be on the corner of 441 and Okeechobee Boulevard. If you have any questions, the phone number is 561-223-6460, and you're able to email any questions to them at adminhealthnavigationsystems.com. And so your grand opening is coming up soon, about 2 weeks, correct?
2 to 3 weeks.
2 to 3
Yeah.
weeks.
Yeah.
How are you feeling about your grand opening coming up?
Well, we're excited, and as you know, with any startup, there are details that you have to attend to.
Definitely.
So I'm in that mode of attending to make sure that we have the I's dotted and the T's crossed, and that we're ready.
Is there going to be a grand opening? Anything that the listeners can attend and things
There
like that?
there will be.
Oh, perfect.
There will be a
perfect.
grand opening, but as I said, the target date is the September. The target date is the 12th. So, it will be maybe 10:30 or so in the morning. But hopefully we'll get our website will be up and running, and so people will be able to access the website.
Perfect.
Everything is not 100% in terms of our T's being crossed and our dots and our I's, but we'll be by then.
That is so exciting, though.
Yeah.
Being able to open a new practice is such a marvelous thing to do.
Thank you.
So for our listeners watching, I want to switch directions a little bit because you have so much experience in the medical field. I want to get your take about the state the country is in right now when it comes to the insurance and what patients have to deal with on a day-to-day basis.
Well, I think the providers, maybe the ones, both people. I mean, the high premiums are prohibitive sometimes for patients who want access to healthcare. And then payers who have to collect from insurance companies, they have they have also their own challenges with that. So having this type of model, I think, brings solutions. And that's why I think it was appropriate to choose that, where the provider, the subscription-based model, well, I should say this is it will be a hybrid model. We'll do both.
Okay.
About maybe 80%, 70 to 80% of our clients or patients will be from the subscription fee-based model, and the rest will be from the payer model, where we're collecting from insurance companies, so that we're accessible for everyone. So I should remember to say it's a hybrid model.
Okay, perfect. And again, that's such an amazing model that you have implemented. And I know that a lot of doctors are starting to switch over to subscription-based, especially when it comes to primary care.
Yeah.
Because also on the flip side, on the business side, the insurance companies and the doctors dealing with that is always a pain.
Right,
and you're
right.
not necessarily guaranteed the money that you charge
Right,
for the visit
right.
for the patient.
Right,
So
right.
having the subscriptions guarantees that the office will be able to stay afloat and continue to help patients' needs.
Absolutely. And there will be no co-pays. So you come to the doctor as much as you want. There are no limitations to that. Same day or next day appointments, which will be a great idea. Same day or next day appointments. A lot of times people try to call their primary care doctors, and sometimes they're not able to get an appointment until maybe 2 months or 3 months later. So we'll be able to solve those challenges.
So I know that you mentioned that your physicians and your doctors will only be seeing around 20 patients a day, something like that, so that way they don't become overworked. How will that work when your business starts to take off and managing new patients?
So the goal is to actually have a cap for the
Okay.
practice, for the panel,
wow.
for the patient panel.
Okay.
To be able to be, to stay in alignment with that vision and with the practice model. So the goal is to actually have other medical practices.
Oh, that's so you're open. Are you thinking about opening up more businesses?
Yes, absolutely.
Okay,
So this
good.
will be the one of many.
So how long have you been in South Florida for, in this area in particular?
6 years.
6 years?
Yeah.
How would you say, in your experience, in your opinion, this type of practice would benefit the communities down here in South Florida?
Well, I think because there are a lot of immigrants, there are people who are not documented. There are a lot of people who are in business for themselves, small businesses, and they're not able to afford the premiums. There are people with very high deductibles. They chose that plan because it's better. You know, they may be looking for higher coverage in hospitalizations. We'll be able to help them. So there are people, a lot of young people who may need access. So I think it benefits a lot. People.
No, definitely.
Yeah.
And the fact that you will still take insurance if people
absolutely.
need that, they will still have that option.
Absolutely.
That's definitely very great. So tell us a little bit more about the price range for your monthly subscriptions.
It's $85 a month and $120 for registration, and we'll incorporate a physical with labs for that to start on. And we prefer to do the collections on, up front instead of doing monthly collections, to ensure that we don't have to have a whole department that handles collections.
Sense.
Yes, and I think it's not prohibitive because certain if you go to the hospital or you go to urgent care, you will pay $200 to $300 for that one visit or more.
Definitely.
So I don't think it's prohibitive. I think it's pretty affordable.
I think it's definitely affordable too, because after that initial payment, it's only $85 a month, which is a whole lot less that you would have to pay for your insurance. It's a whole lot less that you have to pay for an urgent care visit or even a hospital visit. So at the end of the day, you're able to make it affordable for the patients and easier on the side for the business standpoint and the doctors as well.
Absolutely.
That's truly amazing. Is there anything that you would like to add about your practice to our listeners?
I think we'll also do IV infiltration for vitamins. We'll also do health coaching. I think I said that already.
Yes.
Yeah. So I think IV filtration is a very big part of healthcare. So we'll also give access to that. Behavioral health is also a part that we'll be looking at too, because we know that we really want to serve and help people. And that's one of the concerns in our country. So
tell our listeners a little bit more about what behavioral health is and what that encompasses.
Well, what we're planning to do is counseling with a behavioral health provider.
Okay.
So that's something that we will contract with someone to do, and insurance. Someone who has insurance will be able to cover that. Now, if they do not have insurance, then that's how, the contractual agreement that we have with that person, our goal is to ensure that people are able to afford it. So the volume that we provide will make it more affordable for them.
No, definitely. That's, again, absolutely amazing.
Yeah.
I work as a personal trainer. So being preventative care is what I do every single day.
Right,
and I always tell my clients that you can prevent so many of these things, so many of these issues, so many of these chronic diseases from happening just by keeping up and being on top of your own personal health.
That is absolutely. As a matter of fact, I think the doctors should write scripts for exercise.
No, I think so too, because it's a lifesaver.
It is. It helps with circulation. It helps with everything. So you're in a very good field also.
No, definitely. Yeah. So I know I just touched a little bit about the chronic diseases and your experience, because again, I always touch on your experience because you've been in this field for such a long time. I think that's so beautiful. How would you say the chronic diseases have been affecting the overall population of the U.S.?
I think that we could do a better job with managing. And I think the reason that we may not be as effective as we can be is because we are not able to spend time with the patients and we're not able to interface with them. So one of the solutions, I believe, will be the care coordination. Initiating the outreach, not waiting for the patients to call. We're also, we haven't instituted this yet, but it's something that we will be thinking about in terms of having monitoring, the ability to monitor patients' blood pressure, their pulse ox, their oxygenation, and stuff like that electronically into our office. We'll be able to do that later. It's not this minute, but it will be something that I'm looking at.
But there's technology and systems in place.
We will
that
be
you can
incorporating the
adopt.
technology.
Oh, that's cool. That's
to do
very
that.
nice.
Yes.
So you're able to really stay on top of
Absolutely,
everyone's health.
absolutely. I think we can do a better job with that, but we do not have enough times when the patients go into their primary care doctors because there's just not enough time.
There's just not enough time.
Yeah.
No, exactly.
Yep.
And again, you're able to find Healthcare Navigation Systems Clinic at 10287 Okeechobee Boulevard, Unit 26, West Palm Beach, Florida 33411, Cobblestone Village Shopping Plaza. And it's going to be located on the corner of 441 and Okeechobee Boulevard. You're able to reach the office at 561-223-6460. And if you have any questions, please feel free to email them at admin@healthnavigationsystems.com. So we're starting to come to a close a little bit on the show. Is there last or any closing words that you would like to add for our listeners tonight?
Well, our goal, I think that when you have a business that's in the role of servant, providing a service to be a servant of people, I think with the goal of bringing solutions, our focus will always be patient-centric. And so I think that, that is if your vision is patient-centric, the patient's outcomes will always be driving your decision-making. And so even to start thinking about making an outreach call to the patient without them calling you is important. So our goal is to be patient-centric and have better outcomes for patients.
Amazing. Absolutely amazing what you're doing. And again, that is all for us today. Welcome. Thank you for tuning in for another episode of You and Your Doctor, sponsored by All County Healthcare. And again, Healthcare Navigation Systems Clinic is going to be located at 10287 Okeechobee Boulevard, Unit A6, West Palm Beach, Florida 33411. And if you need to reach them, please feel free to call at 561-223-6460. That is all for us tonight, and thank you for tuning in to another episode of You and Your Doctor.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first.
South Florida's Good Time Oldies is here.